have swelling or tenderness in one or more joints? Is it accompanied by joint pain or stiffness? Then you may have arthritis. Arthritis tends to be one of those pathologies or diseases that tends to cause inflammation around the joints, which can lead to stress to those joints or inflammation in the area or swelling, which will give you that pain response. There's a couple different types of arthritis. One of the most common one is OA or osteoarthritis. The second is RA or rheumatoid arthritis, and there are a couple other subtypes within those other arthritis types. In osteoarthritis, there can be a couple different factors which can lead to it. These can be age-related, gender-specific, joint trauma, and even obesity. RA, on the other hand, is an autoimmune disorder. It's an autoimmune disorder which tends to cause systemic inflammation, which can lead to a couple different things, and over time it can cause RA, or arthritis in this case. Now, when there was a couple studies done, they found that roughly 1/3 of Americans have arthritis present on any radiographic imaging that they get done. This number tends to increase as you take different age groups and different populations, and it increases as they get older. A couple different places that arthritis tends to affect is the knee, the hands, the elbows, and even the hips. These are the most common areas that are affected by it and where you'll tend to see progression of arthritis or OA. OA is a progressive disease that over time causes progressive cartilage loss, which can lead to bone damage. Some of the characteristic findings that you'll find in people with OA or osteoarthritis are some cysts, osteophytes, and even subchondral plate thickening. So let's cover the progression of arthritis and what it can look like, how it can appear, and what may be present with the symptoms and pain during it. Most of the time, osteoarthritis tends to be of insidious onset, which means it can start gradually, subtle, and even cause harmful effects in the long term. Now, arthritis can be a couple different categories. It can be monoarticular, which is a single joint. It can be oligoarticular, which is 2 to 4 joints, or it can be polyarticular, which can include several different joints. For osteoarthritis, it is common to be found in the axial skeleton as well as the spine. The most common modality that will help find if someone has osteoarthritis is radiographic imaging. You'll tend to see joint space narrowing, osteophytes, joint effusion, and other common inflammatory findings within the actual joint space. Some of the symptoms that are associated with arthritis or osteoarthritis is pain or aching during any type of activity. This can also include joint stiffness, limited range of motion, and even some like clicking or popping within those joints. Some may have swelling around the joint, some muscle weakness in the body's response to limit any range of motion to do any further damage to the area. Some individuals may also see some joint instability as well. In the past, literature has described osteoarthritis as a non-inflammatory response, but new literature coming out today has shown that OA or osteoarthritis is indeed an inflammatory response. So with that being said, since OA is an inflammatory disease which causes degradation to the joints, which can progress over time, you want to avoid certain things such as large amounts of red meats or foods, fried foods, processed sugars, and refined carbohydrates, as well as excessive amounts of alcohol and tobacco, as these tend to increase our inflammatory response. On the other hand, things that we do want to do is maintain a healthy body weight. You want to make sure that you control the amount of sugar that you are intaking, get physical within reason. You want to make sure that you protect your joints, and to make sure that you get the appropriate care that best suits you. Since OA does tend to affect older populations, one of the best rehab exercises that is recommended is such as walking or even aquatic therapy. When it comes to treating osteoarthritis, chiropractic care can be a part of a comprehensive approach to help managing your OA. The idea behind this is to focus on the musculoskeletal system, which includes the spine and joints, and we kind of aim to improve your overall joint function, mobility, range of motion to kind of help you get back into the swing of things. So that way you can perform your daily tasks, whether that's, working on your boat, going fishing, doing your gardening work, just your day-to-day activities, because most of the time just even getting in the car, it can be a strenuous task, or getting out of bed first thing in the morning. It's just very difficult when your joints are not technically in gear for the movement. So by going to the chiropractic care, you can kind of get that treatment. That muscle tenderness or soreness will be treated. Any joint stiffness will be worked on. Just kind of that physical rehab, kind of moving you through the range of motion, getting you to be able to do the things that you once were able to do, and help treat the pain that you have with manual therapy. Some of these modalities include soft tissue work, electrical stim therapy, joint mobilization either through spinal decompression or flexion and distraction done by the primary care doctor, in this case the chiropractic physician. And even things such as like nutritional consultation, letting you know what you should and shouldn't eat, how you should go about your daily routine, any stretches that you should perform. By getting into the physical realm of soft tissue modalities, specifically with the chiropractor, they'll have that experience to really see what areas are tight, what muscles are preventing you from doing those motions, and ultimately limiting your range of motion, causing that progressive inflammatory response that is normal with aging but limited by the pain that you're feeling.